Hello friends, thanks for checking out the video. Be sure to like and subscribe as it greatly helps out the channel and I'd really appreciate it. Enjoy!
So to that extent, use that as much as I can as a segue to this second article that also, includes American and European adults. This article, everyone, is called Compensatory Connections, Living Alone, Loneliness, and the Buffering Role of Social Connections Among Older Americans and European Adults. Right, living, loneliness, we've all been there, but how is this more impactful and how do we see it amongst older populations, which I think y'all bring some really interesting and really important questions that might honestly be overlooked in the day-to-day life, amongst the general population. So to begin, y'all talk about the compensatory connection hypothesis. Can you just, let everyone know kind of what that is?
Yeah, so the basic idea is, the problem that we're looking at here again is it's known that people that live alone tend to feel lonelier, right? There's a multiple risk factors for loneliness in later life. Living alone is one of the major ones. That isn't to say that everyone who lives alone wishes they lived with others. A lot of people are perfectly happy living alone. But of the various things that predict whether people have these feelings of not having their social needs met, living alone is really one of the, if not the major demographic predictor, the chief explanation of it. The idea here, though, is that people could compensate for living alone by having rich social networks outside of their home and a lot of community engagement. And so we were asking the question, if somebody lives alone, but yet they are involved in their community through organizations and clubs, if they have large, diverse, rich networks, people they see regularly, can that situation kind of offset their living arrangement? And like you said, we're looking at that both in the US as well as Europe to see whether that compensatory pattern would play out the same or differently in both contexts.
Yeah, I mean, makes sense, right? I know not to always drag religion back into this. That's just the Chris Elson in me coming out. But you talk about communities, things, even attending religious services, right? That's one thing a lot of scholars looking at health and religion kind of notate is it's just the fact that you're getting out, you're getting to a social event, right? Basically, it's very highly community based. That's allowing you to make these kind of just connections or really just interactions, I should really say, that help divert feelings of loneliness and perhaps isolation or, right, clubs, even as I know it's become more common since the pandemic, like even things like virtual happy hours, right, is that quasi feeling of you're not face to face, but you're still talking with your friends that, for what the couple years that the pandemic was really in full swing, you weren't able to, or at least supposed to see, on a face-to-face basis. So, I mean, that makes sense. I mean, it seems pretty, straightforward, understandable, theory in that sense of, compensating with the respect, to these health concerns. So what were or are the expectations for older adults living alone that you found or that you could share with everyone?
Yeah, so we kind of thought of two ways that the compensatory connections could play out. One would be that, people that lived alone yet were richly connected outside their house would have loneliness levels that were basically on par with people who lived with others. So basically would offset the loneliness penalty of living alone. That was the full compensation idea that we had. But we thought maybe there's just a partial compensation. Maybe there's some benefit if you live alone to being richly connected with others, but it doesn't yet bring you completely in line with what you'd feel like if you lived with other people. And so we tried to sort of test the extent to which compensation worked. And so we gathered the data, same data source from Europe that we talked about in the last article. But then we found another study in the United States that was really nice because it kind of matched the same time frame as the European study, the same years. It was across two different time points in the mid-2010 decade. And they also had the same measures, more or less, about people's social networks. So they asked about, again, who are the important people in your life? What relationship do you have to those people? How often do you see them? And they also asked about things like you mentioned, like how often do you go to church? How often do you volunteer in the community? How often do you go to other sort of social clubs and see other people? And so we put together those different sets of measures, people's networks and also their community engagement. And we looked at an analysis that to try to tease out how much those two types of connectedness, networks and community engagement, would offset loneliness of living alone. And it turned out that we were not able to find a full compensatory effect. We were not able to find that being connected outside of the house leveled the playing field for people that lived alone versus not live alone. And so what we concluded from that is that there seems to be something very important about the sort of ready companionship that's available to people when they live with a spouse or partner or with somebody else. And it was actually pretty consistent. Europe, United States, we actually weren't able to find any different patterns of compensation across those two contexts.
Wow. Yeah, and I thought that was pretty cool. Pretty interesting, right? That is, I won't say universal, but between these two major societies, I know different countries, but just the fact that having a significant other, right, to that extent is still very paramount in combating the feelings of loneliness, even if you are right, as you're saying, without that partner, but still active in the communities, it doesn't fully offset the effects, right?
Yeah, that's a good way to put it. Yeah.
Okay. So, the fact that there seemed to be a general, uniformity between that and the US, I think that really is interesting. Chad, I hope y'all find that as interesting as I do. Just the fact that there are some factors that can kind of go across the sea or ocean in that sense. So what about how useful then would y'all say, your findings kind of lean to understand how having extra household connections, affect compensation? So I guess, could be your thoughts on additional family members, especially, here in southern states, especially among, cities. What's coming to mind was populations with higher Hispanic populations, right? Their culture, more expectation of having extended family, I guess is what I'm trying to get to, living within the household. Like, do y'all think, kind of based on your results and what you're finding, would that further strengthen this result, the results y'all found, or not, change it too much?
Yeah, that's an interesting question. So I think part of what your question is driving at is, does it matter who is living, in your house, for instance, that could alleviate loneliness? In this case, is it a romantic partner that's really most important, or it, could be a roommate? Could it be a family member, an extended family person that's living with you? And that wasn't something that we actually dug into in this particular study. So that's kind of a nice follow-up question. In terms of how that would fit in the United States, particularly in some ethnic communities where intergenerational households are more common than, say, the white majority in the United States. That's a really interesting question, and I do know that there's quite a bit of literature that says that there can be stresses and strains, whether it's with a partner or whether it's with extended family members in the household. It's not always an unalloyed benefit for people. There's kind of an ambivalence oftentimes with a lot of these family relationships. And so, it could be that your partner alleviates loneliness, for instance, but it could also be that your partner drives you crazy in a lot of other ways. And whether on balance that's good or bad for you, that may really differ according to your expectations or a lot of other types of characteristics of your context. So I don't know. I'm hesitant to make a really big speculation on whether intergenerational household relationships would operate the same way as partnerships. It is a good question. The other thing I guess I would say to this too is that these are sort of effects on average, right? A lot of people, I think rightly so, kind of celebrate the fact that we have so much more acceptability of living alone than we have in the past, right? It used to be much more stigmatized for people to live alone. even earlier in their life, if they never partnered and were just living alone, through their middle-age years. And we have a whole lot more diverse kind of arrangements that people are in. And one of the things, that's kind of interesting demographically is that we just have this whole growth of people all different ages living alone, more so than any time in the past. And for a lot of people, that's by choice. They really like the flexibility and the privacy of living alone, not having to, say, share a sink and a bathroom with other people. They like having that space all to themselves. And we actually heard some pushback from this article that we had written, where a lot of people said, I like living alone. Who are you to say that it's loneliness inducing to have my own space? And to that, I wanted to say, these are average effects. It may be that you prefer that, but on average, there does seem to be something at a population level that's really irreplaceable in terms of having other people around.
Absolutely. And, any of my students, if you're listening, or if you do end up listening to this, because I don't know if I'll assign it to my class or not, but this is why I always emphasize we use words like tend to or increased likelihood, never absolute causation, because I can already hear some of them, as we discussed, things like absolutely, at least here in the US, right? There's been this huge wave or trend in, van life living, right? People decking out vans, spending as much money as it would cost to buy a house to buy a van, and just, being able to travel. And because remote work, has become more of an acceptance, again, large in part due to the pandemic. People are like, yeah, I don't need a house. I can move around. Don't need all those connections. And also, if you think about it, I don't know the extent that it is now, but here in the US, right, you were economically punished for living alone, right? Not being married, different tax breaks, what have you. So I do think a lot of that, and as you put it, I really liked, is the stigma is, mellowing out a lot more. People are still spending their 20s, right? Going through this whole stage of emerging adulthood, finding themselves, getting, their lives together, not rushing off to get married, start a family, enjoying more exploration, is as it seems. So I definitely understand the pushback, but also highly agree. And what I was trying to tell my class is a lot of our research looks at averages, general trends. So I do think it's very interesting, because I have heard, comments, people who love, I can get home whenever I want. I don't have someone, texting me to hurry up, get here, come to bed, things, of that nature. As you put, which I can relate to, and many of you probably can too, the whole sharing a sink. It's the little struggles in life that I guess build up for some.
Yeah, and the pandemic's an interesting note too. I'm thinking of the van life, phenomenon. I think there was a story in the Times about this just last few months, and they said it was about people who loved the van life until the pandemic came, and then it became very challenging to do many things just logistically with living a van life when so many businesses were shut down, and kind of the places where people would go to get things they needed to live. It just was a lot more challenging. And I think too about living alone. For a lot of people, it was great when you could go easily out to restaurants or cafes and things were open. But then during that period of intense lockdown, for a lot of people, that was that moment where it was very challenging to be living alone. And so I think of these kind of moments that punctuate, these kind of unusual moments that punctuate our lives, where I feel like probably it's helpful at those times for people to have a fallback and to be able to have someone else around. But maybe when things are smoother sailing, it's a lot more comfortable for a lot of people to navigate by themselves.
And that is a really good point. Thing about that, it's, if I'm not mistaken, during, like as you put it, the intense lockdowns, even national parks were closed, gyms were closed. And for y'all that don't know, those were prime locations to, go if you're living the van life, because they'd be great places to get showers, to hook up for, refill water. And so a lot of your stop locations are all of a sudden removed or denied. So yeah, I mean, it makes sense. I kind of starts formulating some follow-up questions on that, but I don't want to go too off on a tangent there. But yeah, that really, like you said, these kind of historical moments, like a pandemic, right? The likes we haven't seen, and basically a century, how that has changed, especially with regards to companionships. And interesting on the thought, people might view it as, oh, it's nice to have, someone to be in contact with, which again, generally speaking, everyone and students, because from what I've been reading too, you also have negative effects like, things like partner violence, increased alcohol usage due to lockdown. So, relationships, companionship, but nevertheless, as your article kind of pointed out, talking about how residential companionship is still just fundamentally more beneficial than having these externals. Do you have any other comments on kind of like these findings or thoughts, Marcus?
No, I think you covered a lot of the articles, so I don't have anything else to add on top of that.
Okay, fantastic. Chat, still got a little bit of time, so if you still want to ask questions, please feel free. Don't be shy. It's not like class, no one can see who you are. Well, while we give them another minute, again, Marcus, I'd just like to, take this time to thank you again for, I know it's a bit late over where you are, but I really do appreciate you taking the time to, sit down, discuss these articles, especially with, I think they've become even more relevant given, time since the pandemic, right? Just this explosion of lack of connection and then everyone trying to figure it all out again, right? Can we go to events? What's the protocol? What's the health safety? Is it still going to be the same kind of feelings and level of interaction and socialization that existed before, this huge pandemic kind of threw everything into a limbo? Do you have any other, thoughts, especially when it comes to US culture, because there obviously still seems to be a lot of turmoil?
Yeah, so I really have hopes of studying kind of how people emerge from the pandemic and kind of how, whether this was kind of just a blip in terms of the social connectedness that people had, or whether it kind of might change some of the trajectories of connection that people might have had for the longer term. For a lot of people during the pandemic, there was a lot of strained relationships. There were a lot of families that differed on views like things like vaccine mandates or even policies related to lockdowns or masking. And I'm really curious about, in families, relationships that were strained during the pandemic. Was that something that was patched up easily and that kind of relationships have kind of carried on like they were pre-pandemic levels? Or how common was it for there to be strains induced by the pandemic that never really healed? And so I'm hoping to kind of study kind of for pandemic towards after pandemic to see how much kind of turnover or disruption long-term there may have been in some people's networks.
That's a fantastic question and thought. Yeah, it's I'm sure everyone who's listening, of someone or you've experienced it yourself, right? As family members or close friends who have very, extreme political or health related views that cause intense friction. And at least I know from an anecdotal point that some have not healed, right? I still know some family members that will not talk to each other now, all because it wasn't the pandemic, but it was the political ideas and or health ideas that, were kind of spurned by it. So I think that really is, how is that going to impact the connectedness, right? If everyone you had these close connections with are now, have this, I don't want to say grudge, but kind of this, tension between them that was not there before. Well, awesome. Okay, everyone. Thank you all. And Marcus, is there any thing you'd like to add before we end this episode?
No, just thanks, Colton. I appreciate your careful reading to those articles and your good questions. And I enjoyed our conversation.
All right. Well, again, thank you so much, everyone. Dr. Markus Schafer. Please check out his work in the comments. Don't worry, I will be posting the articles so you can look them up yourself. And as always, feel free, message me if you have any additional questions. I'm happy to answer the best that I can. And so everyone, until the next time, this has been another episode of A Social Inquiry. Stay well and take care, and we will see you then. So thank you, everyone.